is it not?
You can take my talk and replace it with AMD, and that would be what Shrikant presented. Anyways, so today I'll talk about extent and rod-related topography of SDD, or subretinal drusenoid deposits, and how they impact vision in aging and age-related macular degeneration. I am currently employed at Apellis Pharmaceuticals, but this work is done during my time in academia at University of Alabama. Okay. So, as you know, that AMD is a major cause of irreversible blindness in older adults. The hallmark characteristics of AMD include drusen, and you know that these are yellow, and these are very lipid-rich deposits. There's another type of lesions called subretinal drusenoid deposits, which is also known as reticular pseudodrusen. And these are shown in the arrowheads in orange, and these localize in the subretinal space. In 2021, we looked at this distribution of these deposits in a histology approach, and we found that these seem to be localized more in the superior quadrants. And in the same year, Robin Guymer's group in Australia had published an OCT-based method where they found that the predilection of these lesions tend to be in the superior periphovia. So we wanted to expand on this work, and there are three really big questions here. How does SDD distribution change with AMD stage? Is it related to rod and cone-mediated functions? And is it related to the topography of the photoreceptors in the retina? So to establish this, we generate a deep learning approach. And I'm not going to go into too much detail about this, but we essentially trained the model to detect SDD using a validated manner using a convolutional neural network. And the segmentation model was actually performed on almost 1,000 eyes. And there was a proofreading step where a trained grader looked at en-face OCT and cross-modality performances to establish the binary masks that were used to quantify SDD. So what did we find? We found that SDD area and visual functions worsen with AMD severity. Remember, these are graded on the AREDS-based grading system. You can see that the area of subretinal drusenoid deposits increased with disease severity. They were the greatest in the intermediate AMD group. And both rod and cone-mediated functions significantly worsen with AMD severity, which is not new, but it was good to see that in this cohort. So this is the new data. So we looked at the distribution of subretinal drusenoid deposits by AMD severity. When we looked at the normal eyes, which were graded as normal using the AREDS grading system, we found that even normal eyes tended to have SDD. They first appear in the peripapillary area, and they kind of diffuse superiorly. In the early AMD group, you can see that they're diffusely distributed. And really, in the intermediate AMD group, majority of the SDD are present, and you can see that there is a very specific distribution that spares the fovea when it comes to these lesions. They are low in the fovea, and they have a highest density in the superior perifovea. So how are these deposits related to visual function? Now, we looked at a battery of tests in All-Star 2, which included rod, cone, and mixed rod and cone responses, so in the scotopic, mesopic, and photopic conditions. And we found that the rod intercept time, or using dark adaptation, scotopic mean sensitivity using microperimetry, and mesopic mean sensitivity using microperimetry again, were significantly associated with the area and the burden of SDD. So to conclude, So to conclude, we know that subretinal drusenoid deposits are known to confer risk in AMD progression. The distribution from our data looks like that it is topographically unique, and when you compare it with drusen, which tends to be more under the fovea. And in this study, we looked at the largest field of view across and relationship to rod function across all the studies published. And we looked at the function as well, and we found that this is associated with specifically rod-mediated function. We are currently doing the 3-year longitudinal assessment to establish its role in the progression of AMD. So I want to acknowledge the co-authors. This work is actually published 2 months back. If you're interested, I'm happy to, I encourage you to read the article. Thank you.